Hello everyone, welcome back. Today I'll be covering OSCE question and answer. Happy practice. A 55-year-old male post-motor vehicle accident sustained a left knee pain. A. Describe the X-ray and diagnosis. As illustrated the picture. And the answer is AP and lateral view of the left knee joint shows a transverse fracture left patella. With no history of wound, the diagnosis is closed transverse fracture left patella. B. Method of fracture fixation. Fracture fixation may be achieved in various ways. Common method is a tension band technique, only possible after fracture is converted to a two-part fracture. Additional fracture fragments can be fixed using supplementary small fragments screw around 3.5 mm, lock or non-lock plates and wires. C. What are the tension band wire principles? Anterior tension bands principles which allow stable construct for some fracture types, example a transverse fracture, and allow for early mobilization. The tension band lies on the anterior surface of the patella and works by converting a tensile force on the patella surface into compression force at the fracture line. This figure shows the X-ray lateral view of a tension band wire patella post-fracture fixation. There's the fracture line there. D. What is the prerequisite to use tension band wire? Posterior articular cortex cannot be comminuted as it must provide a buttress to allow compression. So, multifragmentary patella fracture cannot be fixed with a tension band. Please remember that. Name 3 other sites that this method can be applied. At the olecranon region, the distal fibula region, and the medial malleolus. F. Complication of this fracture fixation. Potential migration and breakage of wires and pins, erosions of the bone, failure of the fixation methods, loss of reduction, a painful or unsightly scar, development of arthralgia and arthritis, need of a second surgery to remove the fixation hardware, surgical site infection that may lead to osteomyelitis. Additional notes. Patella is the largest sesamoid bone in the human body and has a rounded triangular shape. The cartilage-covered underside of the patella articulates with the two condyles of the femur. This sesame bone is embedded in the quadriceps or patella tendon that displaces the tendon away from the center of rotation, thus increasing the moment arm and increase the force of knee extension. The patella acts as a protective shield for the knee joint, augments the effect of the quadriceps muscles during knee extension, and has a cosmetic function. Adapted from Anderson 1978 and Insole 2006. Description of intervention. Fracture of the patella can be treated conservatively or surgically. Surgery should be avoided in people with high preoperative risk or in those with joint ankylosis, prior failed extensor mechanism, or those who are non-ambulatory. Conservative intervention involves immobilization of the leg in nearly full extension for 5 to 6 weeks using a long leg plaster or other type of cast or brace until fracture healing is evident on X-ray. This is used in non-displaced fracture patella, whereby the extensor mechanism still intact, good preservation of articular congruity, and lack of displacement between the bone fragments. Yay! We have reached to the end of this video. I hope it helps. See you in the next one. Take care and bye.